so let me get this pulled up. Okay, so hi everybody, welcome to my video. We're going to be talking about total parenteral nutrition today, or as it's known as TPN. We're going to just kind of go through what it is, how it works, when we use it, and then we're going to learn how to calculate a TPN solution. So here are your objectives. Again, understand what parenteral nutrition is, or PN is, understand TPN versus PPN, understand how it is administered, what conditions require this nutrition support, understand how to calculate a TPN regimen, and then understand what to monitor. Okay, so parenteral nutrition, what is it? So I like to think of parenteral nutrition as parenteral, so without entering is kind of how I think of it. And so when we talk about your traditional tube feeding, when we think of traditional nutrition support, we think of putting a tube up your nose or in your mouth or in your stomach that goes into the GI tract. And so parenteral nutrition is not that. It is not entering the body in that way. And so parenteral nutrition is nutrition that is administered via an IV, so intravenously. That is how it's administered. Again, parenteral, it's not entering. So different from enteral nutrition, which is your typical tube feeding, so what you typically think of when you think of enteral nutrition. It is not administered into the GI tract. That's really the big difference. And PN solutions can hold all vital nutrients and macronutrients, and practitioners are able to manipulate these nutrients and macronutrients in the formula, which is cool, and we'll kind of see how we can do that later on. So it's a really cool thing to do. And then again, a tip, if you haven't heard this before, I'm just going to say it now. If you can, you always want to try to choose EN or enteral nutrition before you can do PN. So enteral nutrition, or traditional tube feeding, really helps the GI tract stay intact because it's using the GI tract, and so that's really important. PN, though it is safe to use, it can cause further GI dysfunction if people are on it for a very long time. And so if you can, please do enteral nutrition first thing first, but if you can't, and we'll see those circumstances when you can't, then we will choose PN. But just remember that. EN before PN always. So this is just an example of just to show you what PN looks like. And so again, it is administered through an IV. And so you typically have two different types of lines. You have a central access line or peripheral access line, which we will discuss, but this is indicating what a central access line is. So this would be your TPN bag. So this is the solution. It goes into the pump and goes right into the main vein, or one of the biggest veins and arteries, to get into your system. And so when we're thinking of TPN, we're going to think of a central line, and this is kind of what that looks like, just so you have an idea. So what types of PN? So parenteral nutrition, what are there? Basically, there's two types that we talk of. There's TPN, which is the most common one, is the one we're going to be really focusing on today, but there's also PPN. So the difference is really the placement of the line and how much you can administer through this line. So TPN, which is kind of the biggest one we're going to focus on, are for patients who require all or a very high amount of dietary needs replaced. And so this one is the one that is administered through a central access line. So it could be like a PICC line is pretty common. And you can do as high a rate as you need, keeping in mind, fluid balances, and overall just watching the kidneys and watching the electrolytes, and we'll get into that. But really, TPN is the best route to go. It is the most flexible. It's the one that gives you most bang for your buck. You're able to work with it really easily and make it really accommodating for your patient's needs. And so the second one is PPN, or peripheral parenteral nutrition. So this one is really supplemental. It's not typically used for patients whose needs are very high. And so it's usually for people who are smaller or just don't need a lot. And it's just kind of, if they don't need a full nutrition support regimen, we'll do PPN. This is through a peripheral line, and so those lines are typically smaller. They typically go into smaller veins, and so because of that, we cannot administer a very high rate. There is a cutoff as how much you can administer daily, and the cutoff is 2 liters per day, and so that gives us about 80 milliliters per hour that we cannot go above. And so that's really the two differences. So TPN, again, it's a central access. You can administer very high needs. You can meet patients' rates very easily and meet their needs really easily. While as PPN, you can't really do that. It's typically only supplemental. It's typically only used for a couple days, if at all, and then it is administered through a smaller line, and so you can't administer as high of amounts. So when do we use TPN? So we really learn about, wanting to administer nutrition support with people who are not eating, who are under eating, who are malnourished, who can't swallow, and we typically use enteral nutrition or, the traditional tube feeding. But there are times when people are not able to have things go into their GI tract, and so in those times we need to consider doing TPN. And so we do TPN when people have impaired food and nutrient intake, and impaired GI function is really the big caveat there. So, are they not digesting properly? Are they not absorbing properly? What are the signs and symptoms of that? Some signs and symptoms to look out for is, are they having a lot of diarrhea and vomiting and they're just not intaking anything? Are they losing a ton of weight? How are their labs looking? And so these right here just kind of show you the most common conditions we see when we're talking about TPN. So short bowel syndrome, that's a pretty common one, and a lot of these people can be on long-term TPN. Long-term TPN is safe. It is costly. It's much more costly than traditional enteral nutrition is. So it's much more costly than that, but it is doable. And so short bowel syndrome, that's one of the bigger ones we see TPN with. Bowel obstructions are a big one. Fistulas, extreme malnutrition, chronic diarrhea, and vomiting. That usually takes a lot of place in like chemotherapy patients who will probably need TPN because it's causing some GI issues from all the chemotherapeutic drugs they're on. Severe pancreatitis, and critically ill patients. Another one that I didn't put on here, but just it's good to note, is that preterm babies are typically on TPN as well. So babies who are in the NICU are usually placed on TPN because they do not have fully developed GI tracts yet. And so when they're born, they're preterm, they're really small, they're not able to take in breast milk or take in formula like a baby who was born at weight or was born at the full gestational period would be able to. And so for very preterm babies, very small babies, we typically will do TPN because their GI tracts are not fully developed yet. And so just something to keep in mind, just know that. So if you ever go work in the NICU, TPN is a big part of that job. And so that's that for you guys. Now we're going to get into kind of calculating TPN. So it can be very difficult to calculate, but it's not that hard once you kind of get the hang of it. So we're going to go through this step by step, and I'll show you a couple examples, and we'll work through one example together as well. And so let's just start off with the basics, the macronutrient breakdown. And so for our TPN solution, we typically will focus on the three main macronutrients: your carbs, your proteins, and your fats. Or how it is administered in TPN is your dextrose, your amino acids, and your lipids. This is the language to use when we're talking about TPN. When you're talking about enteral nutrition and traditional, tube feeding, you can use carbs, proteins, and fats in your verbiage. But when we're talking about TPN, this is the verbiage we're looking for: is the dextrose, the amino acids, and the lipids. And so, like we learn in early nutrition classes, carbohydrates are typically 4 calories per 1 gram. So for dextrose, because that's where our carbs are coming from, dextrose is a little less calories than your traditional carbohydrate. It is 3.75 kcal per gram. So that's just something you need to know, that dextrose is 3.75 kcal per gram. Amino acids, they're just like protein itself, because they are protein, 4 kcal per gram. So for every 1 gram of amino acids, it is 4 calories. And then lipids, they're a little higher than our traditional, what we think of as fat calories. So instead of 9 kcal per gram, they are 10 kcal per gram. And so these are just something you need to memorize. You just kind of need to know it. So just practice, say it over to yourself 5 or 10 times. Dextrose, 3.75 kcal per gram. Amino acids, 4 kcal per gram. Lipids, 10 kcal per gram. And just know that, because it's going to help you with your calculations. And so once you have that, and once you can remember that and understand that, we move on to a typical TPN solution. So this right here is an adult 3-in-1 TPN solution. Okay, so what does this mean, 3-in-1? It means that we have all 3 main macronutrients in one bag. And so there are some times, especially when it comes to PPN, or the peripheral parenteral nutrition, where you don't have all 3 macronutrients in your solution bag. So let's say for that bag, you only have dextrose and amino acids. So it will be a 2-in-1, and then you'd have to piggyback off of that bag and add a third bag that will contain the lipids. So That's not something we're going to totally get into today, but it's good to note that when you see 3 in 1, it means it has all 3 macronutrients in the one solution bag. And if you see 2 in 1, it typically means it's just dextrose and amino acids, and you need to piggyback the lipids onto it. So this is our solution. So in this solution, this is how much we can have of each macronutrient per liter in this solution. So for dextrose, we can have anywhere from 150 grams to 200 grams of dextrose in 1 liter. For amino acids, we can have anywhere from 50 to 70 grams per 1 liter, and for lipids, 25 to 40 grams per liter. So again, this is just kind of something you need to know and need to memorize, write it down, write it 10 times. As you get into it and you get into working in the field, you will get better at knowing that. And so, but just know right now that dextrose 150 to 200, amino acids 50 to 70, lipids 25 to 40 in traditional solutions. It can change from place to place, but that's traditionally what we see. You might see some percentages in there. And so some people do it based off percentages. So this would say, okay, it'd be 15% dextrose in this solution. So that basically means it's 150 grams in the solution. If it said 17.5%, I would know that's 175 grams per solution. Or if it said 16.5%, I would know it's 165 grams per solution. And so same thing with amino acids. This is 5% and then this is 2.5. So it's really just switching the decimal. So to know the percentage. So if you ever get a question like that, I would ask, okay, this percent here, move the decimal, and then that gives you how many grams. So this is just going to give you an example real quick of how we calculate TPN, or at least this is how I understand it and how I best can teach you how to do it. And so we'll get into how we figure out the rate later, but I'm just going to show you real quick how we calculate it out. So the first thing you need to know is you need to figure out how many liters you need, because we're basing all of our calculations off liters, because again, we saw the solution bag in this slide that it's all based off of how many liters you have. So you need to figure out how many liters you're going to have for that day, and we'll get into how you do that. But it's based off of the patient's needs. So for this example, we're going to say I need 2 liters a day. We're going to say I already calculated the patient out. I'm just going to say they need 2 liters a day. Okay? So for dextrose, because we know we have 150 grams to 200 grams per liter in this solution, I'm just going to stick with the basic 150 just to make it easy. So I get 150 grams per liter. So I have 2 liters I need. So 150 times 2 equals 300 grams total of dextrose. So again, I just took my 150 and times it by how many liters I need, and that gives me how many grams of dextrose I'm going to have in this solution. Same thing for amino acids. I'm just going to do the basic 50 grams per liter, times that by 2. I get 100 grams of amino acids or 100 grams of protein in this solution. And then again with lipids, 25 times 2, 50 grams. That's how much lipids I have in this solution. So that's where you get your grams, and especially when you're calculating out a patient's needs and you need to know how much protein per day they need, that is that number. And so always make sure you check that number and mark that number and make sure it's within your patient's needs, because that's your protein. So now I figured out my grams. Now I figured out, okay, does the calories match how many calories I need? So 300 grams total. So I take my dextrose, 300 times that 3.75, because for 1 gram of dextrose, I get 3.75 calories. So 300 grams times 3.75 gives me 1,125 kcal per that. I move on, do it with amino acids. I have 100 grams, 4 calories per gram. So 100 times 4, 400 kcal from protein. And then again, with lipids, I have 50 grams total. So I times that by 10 kcal per gram. So 50 times 10 is 500. So 500 calories from lipids. Add all 3 of those numbers up, and that is my total calories. So I have 2,025 calories from this solution, and then I have 100 grams of protein from this solution. So if I had someone who needed 2,000 calories and 100 grams of protein, this 2-liter solution would fit their needs perfectly. So just take a minute and kind of review that, and we'll move on to an example. So here's my example patient. You can pause and read as you need, but we're just going to have you guys figure out the needs, and then we're going to work together on how to calculate this out. So example is 55-year-old woman admitted for a small bowel obstruction. She is 5 feet 5 inches. She weighs 160 pounds, has no wounds, and has not eaten in 3 days. She's placed NPO and needs TPN administered. So what are her needs? Do take in account for her BMI and adjusting her body weight, and her ideal body weight. And so you might have to do some adjustments here. Actually, I know you will because I did it myself. You do have to adjust her weight, and we'll get into doing that. So here are her needs, the ones I got. So 55-year-old woman, 5'5", 160 pounds. And so what are her needs? So her ideal body weight, and I've converted it to kilograms. So her ideal body weight is 125 pounds because for the first 6 inches, or first 60 inches, first 5 feet, it's 100 pounds. And then for every inch above that, you do 5. And so 105 times 5 is 25. So her ideal body weight is 125. And she weighs 160. So she's above her ideal body weight. And so ideal body weight is 56.8 kilograms. And then I did her percent ideal body weight. So I just took 160 over 125. That's 127%. If someone weighs above 120%, I typically will adjust their weight and do adjusted body weight. And so because she was 127% of her ideal body weight, I did adjust her weight. And so her adjusted weight came out to 60.8 kilograms. And how I did that, just so you know, I took her, what she weighs now, and I minused her ideal body weight. So I did 160 minus 125. Then I times it by 0.25, and then I added that number onto her ideal body weight. And so that got me to 60.8 kilograms. So after doing that, I just did basic 25 to 30 kcal per kilogram adjusted weight. So her needs for calories are 1,520 to 1,824. So 1,500 to 1,800 calories per day is what she needs. For protein, she doesn't have any wounds. We don't know that much else, so I'm just going to do a standard protein, so 1.0 to 1.2 grams per kilogram adjusted weight. So 61 grams to 73 grams, 60 to 70, somewhere in that range, as close as you can get. So those are her needs. Now I'm going to take us out of this and go to how we're going to calculate it. So lucky for you guys, I typed this out already. I'll make it a little bit bigger. Okay, so again, here are her needs, and here's our solution. So dextrose, 150 to 200 grams per liter. I already went through that. And so basically what I'm going to do now is guess a rate. I know it sounds really silly, but trust me, it works. So I'm going to guess a rate and go from there. So I know prior from when we calculated this earlier that when I did 2 liters, so 2 liters of this solution was 2,025 calories. So that is over how many calories I need for this patient, correct? Yep. And so what would that rate be? So 2 liters is 2,000 milliliters. Divide by, I'm going to do 24 hours for a continuous solution. That equals 83.333, whatever, milliliters per hour. Okay, so that's what that rate would be. So I'm going to call it 80 or 80 mLs because when you're working with this kind of stuff, try to stick to 5s. Try to stick to, 10s and 5s as much as you can. So I know that this rate, this 80 ml per hour or that 2,000 milliliters is too high. So let me just guess a rate. Let's just start somewhere. And if it's too little, I know I need to add more. If it's too high, I know I need to go down. So let's just start with 60 milliliters per hour. So 60 ml times 24 equals the 1,440 milliliters or 1.44 liters. Okay, so that's how many liters I'm going to have in this TPN solution. So I take my dextrose. I'm just going to stick with the 150. So 150 grams per liter. So 150 grams times 1.44 liters equals 216 grams of dextrose for this solution. So we're going to move on to our amino acids. We're going to just stick to the baseline 50. So 50 grams times 1.44 liters equals 72. So 72 grams of our amino acids or of our protein. Lipids, again, just going to stick to the basic 25. So 25 grams times 1.44 liters equals 36 grams of lipids. Okay. Now, something I want to note right here is that the amino acids, after I did my calculation, I started the 60 milliliters, got me to my liters, so 1.44 liters in a 24-hour period. I did my 50 grams times that liters, and I got 72 grams of protein or 72 grams of amino acids. My protein needs are 61 to 73 grams per day. So I'm right where I want to be with my protein. So that's giving me an indication that this rate, this 60 mLs per hour, is the correct rate. But we'll see what we get for the calories. But right now, that gave you a really good indication that I'm in the ballpark of where I need to be. And so that's why I love calculating out the amino acids, because they usually tell you if you're close or not. And so if this said like 50 or this said like 102, I'd be like, okay, not correct, not at the right rate. So now let's get our calories. We have our grams. Let's get our calories. So let's start back with dextrose. So 216 grams times 3.75 calories equals 810 kcal from dextrose. 72 times 4 kcal, because we get 4 calories per gram for protein. 72 times 4, 288 kcal from our amino acids. Then 36 times 10, that's easy, 360 kcal from our lipids. So what is our total? So our total calories, we add all those numbers up, so 810 plus, oops, if you guys get it before me, just let me know, plus 288 plus 360 equals 1458. So 1458 kcal and 72 grams of amino acids. Okay, so my protein is exactly where I want it to be. It's right at that number, but my calories are a little low. I want at least 1500 if I can get it. A little bit in the middle would be better. So what do? Well, I don't want to change my rate. That sounds a little weird, but I don't want to change my rate because this 60 mLs per 24 hours, so 60 mLs per hour, gives me that much liters for the day. And that much liter gives me that amount of protein. And I have 50 to 70 grams of protein to work with. I'm already at the baseline 50, so I can't really drop it. So I'm exactly where I want to be with that. So I don't want to change it. But I need more calories. And so the reason why they give these ranges to us is so we can manipulate it as we need, which is why I love doing TPN, because you can really work with it and make it fit your needs as best as you can. And so I have 150 to 200 grams of dextrose to work with and 25 to 40 grams of lipids to work with. So there's a way I can add calories to this solution without increasing how much solution the patient is getting. So I typically like to leave dextrose alone, and I'll get into why in the next couple slides, but I'm just going to leave my dextrose where it is. I'm just going to leave it at the 150 grams per liter and leave it at the 216 grams throughout the 24-hour period. What I'm going to do is change my lipids. And so again, I have 25 to 40 grams that I can work with. So let's just put it up to 30. Let's see what happens when we increase our lipids by 5 grams. So 30 grams times 1.44 for our liters gives us 43 grams in that 1.44 liter solution. So, and then 43 grams by 10 calories gives us 430 kcal. And so let's add that up. So 810 plus 288 plus 430. So my new number is 1528 calories with 72 grams of amino acids. So that is exactly where I want to be. That perfectly meets my patient's needs. I don't need to do anything else. I have met it. And so just to review, I didn't change this rate. I didn't increase the rate. I didn't change how much liters they're getting. I did not do that. The only thing I did was increase how much lipids were going to be in this bag. And so that's, again, why I really like TPN, because if you have your certain amount of liters, but you're not quite meeting your needs, but you're close, you can play with these numbers and play with these amounts. Increase your dextrose, decrease your dextrose, increase your lipids, decrease your lipids, increase your protein, decrease your protein, whatever, to make it fit your needs if you don't want to increase your fluid, because fluid overload does happen, and so it is a really useful tool to be able to do that. And so that's what I did, and I got lucky on my first guess, but really I truly just guessed a rate. I just picked 60 and just kind of went through this, and I'm lucky and it worked out pretty well on the first try. But if this wasn't meeting her needs, if I picked 60 and I got like 50 grams of protein here, I would have known right then that I needed to increase my rate probably. And so let's just do another example just so we can really get it. So I'm just gonna say a male, he is 40 years old. I'm gonna do this pretty quickly. He is going to be 72 inches tall, and he's going to weigh 200 pounds. And so 200 divided by 2.2 to get us our kilograms, he is 91 kg, about. So we'll just stick to 91 kilograms. And so let's look at his ideal body weight. So he's 72 inches tall. And so for the first 6 feet, so 60 inches, it's 106. And every inch after that is 6. So I'm going to do 12 times 6, which is going to give me, oh wow, 72. Then plus that to the 106 equals 178 pounds is his ideal body weight, or let me divide that by 2.2 to get my kilograms, or 81 kilograms is his ideal body weight. And so he's a little above his ideal body weight, so it's 91 kg divided by 81 kg. So he's 112% of his ideal body weight, which is good. That's not too high, so we're going to just keep his 91 as our calculating factor. And so let me now do this. So 91, so we're going to do 25 to 30 kcal per kg. And he's 91 kilograms, so that gives us a range of 25 times 91. Wow, this guy needs a lot. 30 times 91, 2730 kcal, and then protein. I'll bring this down so we can see it. And so for protein, we're going to do 1.0 to 1.2 again, just to keep it simple, per kg. That's going to give us, so 1.0 is going to be 91 grams per day. 91 to 1.2 times 91 to 109 grams per day of protein. So this is my protein goal. Oh, yeah, I just saw that right. Okay, so 91 to 109 grams of protein, really high calorie needs. So I know I'm going to need a high rate. Okay, so let's start. So I know that 2 liters got me 2,025 kcal earlier, and I need above 2,000 kcal. And so I'm going to need a higher rate than 80 milliliters per hour. So let's try 95 ml per hour. So 95 times 24 equals, okay, that's pretty high rate. So mLs, or 2.280 liters. So let's start with the dextrose. So again, I'm going to start with 150 grams per liter. So 150 times 2.280 liters equals 342 grams of dex. So that's pretty high, but again, he's a big guy, so it's okay. And then amino acids, we're just going to stick with the 50 grams times 2.280 equals, because I'm pretty sure that will give us right where we need to be too, 114 grams of protein or amino acids, and then lipids. So I'm going to just do the 25 grams. Okay, so 25 times 2.280 equals 57 grams of lipids. Okay, so my needs are 91 grams to 109 grams of protein. So I'm at 114. So I'm pretty high here. So we might need to maybe pick a different rate, because I know just from the protein, that's pretty high. It's not that much higher than his needs, so it's probably not that big a deal, but we try to be within the range. And so maybe let's just drop our rate down to 90 milliliters and see what that gives us. So 90 times 24 equals, okay, that many milliliters, or 2.160 liters. Again, let's do dextrose. 150 grams times 2160 equals 324 grams of dextrose in a 24-hour period. Amino acids, so 50 grams, times 2.160 equals 108 grams of amino acids, which is perfect. And then lipids, 25 grams times 2.160 equals 54 grams of lipids. Okay, so now my protein's a lot better. Now I got 108 grams of amino acids and I need 91 to 109. So that's perfectly within my needs. So that's giving me an indication that this 90 milliliter per hour is my correct rate. So now let's just do the calories to make sure we're meeting our calorie needs as well. So 324 grams of dextrose times 3.75 kcal is 1215 kcal from dex. 108 grams of protein times 4. Times 4. I'm just writing kcal for you so you know that. It's 432 kcal from amino acids. And then so 54 grams of lipids times 10 kcal equals 540 kcal from lipids. So what are our totals? So my totals, adding up all the calories I get, so 1215 plus 432 plus 540 is 2187 kcal and 108 grams of protein, of amino acids. So again, this is a scenario where I'm a little lower on my protein than I would like to be. So I'm at 2187 and I wanted 2200. It's really not that big a deal. It's pretty good that it's right there, like it's pretty close. But again, I'll just show you what happens. Maybe let's just increase our dextrose by a little bit. So maybe let's try to increase our dextrose to 155 grams instead of 150. Because again, I have that range up here of 150 to 200 grams. So I can really pick any number between those numbers. So 155 grams times 2.160. So times our liter is 334 grams from dextrose, and I times that. No, it's 334.8, so I'm going to do 335. So 335 grams from dextrose times 3.75 is now we're going to get 1256 kcal. So it might not be that big a difference to change, but let's try it. So 1256 plus 432 plus 540 is now giving me 2,228 kcal and 108 grams of protein, which again is perfectly within my needs. I'm at least above 2,200, which is what I wanted to do. So that makes me good. Again, I don't typically like to increase the dextrose, but that just gives you an example that you can really manipulate any of these 3 macronutrients and the amounts you're putting into the solution to get the needs that you want for your patient. And so I would just practice these over and over again, or maybe, go home and just write out example, needs for patients, write out examples of patients, different heights, different weights, and calculate your needs and then try to meet them and see what happens when you manipulate. Because really, again, all I did was just pick a random rate to start off with per hour and then figured out how many liters that would give me. And then from there, I figured out what the solution gives me and I can play with it from there, because that will tell you how, if you need to go higher or lower. And so that's how I do it. It makes the most sense to me, and that's how we calculate TPN. So now that we figured that out, let me X out of this and go back to our slide. And so we did our example patient. We learned how to calculate. Again, I would go back and try to redo those just so you can really get the hang of it. So this is just a review. So again, calculate your patient's needs. Start with a rate. Just pick a rate and just see what you get. Calculate the dextrose, the amino acids, and lipids by the goal liters. And so find how much liters you want, and you just calculate those grams by the liters. After you get the grams, multiply the grams of dextrose, amino acids, and lipids by kcal to get your calories. add it all up and just make sure it all fits for your needs. It's pretty simple, but once you do it over and over again, you'll really get the hang of it, and you'll really start to guess correctly on the first try because you'll understand what amount, what rate, what it's going to give you for those solutions. And so it's really cool. You do get good at it once you do it more. So a couple things, just because when we administer TPN, there are things we have to look out for. So the 3 big things we really want to pay attention to are refeeding syndrome, hyperglycemia, and fluid overload. So with refeeding syndrome, we really want to closely monitor our electrolytes. And so typically when people come in for TPN, they really haven't been eating for a long time. They're pretty malnourished, or they're really at risk for malnourishment, and they're probably not going to eat for a while. And so this is something we really, really try to monitor. So typically we'll start with our rate, start at a really low rate and slowly increase it over a few days. But while you're doing that, just make sure to check on these electrolytes, and you'll be talking to the pharmacist and talking to the nurse and talking to the doctor. We'll all be monitoring these. But phosphorus, potassium, sodium, magnesium, those are the big ones that you really just need to pay attention to when we're looking for refeeding syndrome and administering TPN. Hyperglycemia. Hyperglycemia is a big issue when it comes to TPN. A lot of people just get high blood sugars because, again, if you think about it, this solution is going straight into your veins. So everything you're putting into it is going straight into the veins, straight into the blood. And so you have high dextrose, which is your glucose. That's a lot of sugar, your dextrose is giving you that sugar. So it can really increase that amount in patients, which is why when I was manipulating my macronutrients, I was saying I typically don't like to increase the dextrose if I can avoid it, because I don't want to cause hyperglycemia in patients. And so always try to increase either your amino acids or your lipids if you can. If you need to increase the dextrose a little bit, that's okay, but just make sure you watch it. And RNs will be taking blood sugar throughout the day. They typically take it about 4 times a day. And then fluid overload. Again, you're putting this solution right into someone's veins and arteries, and they're getting it right into their system. And so fluid overloaded does happen. And so that's why we also need to watch out for how high a rate we're doing, which is nice that we can manipulate our macronutrients, because you don't always need to increase the rate to increase the calories and protein, which is what we did with our examples. And so look for signs of edema, look for decreased oxygen output, look for any breathing problems. The nurses are the ones typically checking on this, but you can be checking on it too, and just familiarize yourself with that those are signs of fluid overload. And so if you see someone being fluid overloaded, we'll probably stop TPN or greatly decrease our rate for the time being. And that is TPN, that is parenteral nutrition. So again, parenteral nutrition is administered through an IV, and that's what differentiates it from EN or enteral nutrition. It does not enter your system, is basically what that means. It's not entering your GI tract. So we typically do it with patients who have impaired GI tracts and who are malnourished. TPN is for patients needing all their needs replaced, and again, it is a central line, so just remember that. It is a central access. And then closely monitor electrolytes and glucose when managing TPN. And that's all you need to know, and I hope this video helped you out.